Good day, everyone, and welcome to the Congressional Bailouts Ending Congress's Special ACA Exemption and Why It Matters to Healthcare Reform press call, hosted by Independent Women's Voice. Today's conference is being recorded. At this time, I'd like to turn the conference over to Hadley Heath Manning. Please go ahead.
Hello, and welcome to today's press call, hosted by the Independent Women's Voice. I'm Heather Heath Manning, Director of Policy for the organization. As you are all aware, the Senate voted last week on several health reform measures, all of which failed. Republicans have promised to repeal the Affordable Care Act since it passed in 2010, and they have yet to deliver on that promise, which would allow consumers to choose more affordable insurance coverage that fits their individual needs and preferences. The House did pass the American Health Care Act, a repeal and replace measure, using the budget reconciliation process. During the House side debate, there was some attention to health insurance coverage for members of Congress under current and proposed law. Unfortunately, during the time that President Obama was in office, there was too little sunlight on this issue. Although the Affordable Care Act included a requirement that members of Congress and their staff enroll in plans created by the ACA, President Obama and congressional leaders shaped a special exemption from this requirement in a backroom deal. The final result was a rule issued by the Office of Personnel Management, or OPM, that allows some staff to stay on the Federal Employee Health Benefit Program and allows others, along with lawmakers, to enroll in coverage through the Washington, D.C. Small Business Exchange. The small business exchanges in the ACA are by statute only available to employers of fewer than 50 workers, and clearly Congress employs more than 50 people. The reason for this change was to shield lawmakers and staff from the cost of the Affordable Care Act. Our speakers will offer more explanation about how this works, and we'll be happy to take any questions after their remarks. Independent Women's Voice was the first group to target the OPM ruling in 2013 by launching No Exemption, a multifaceted project exposing how the special carve-out shields Congress from feeling the pain of the ACA's cost. The website, NoWashingtonExemption.com, features a factual quiz that tests your knowledge on Congress's health care, background information on the OPM rule, and a petition to eliminate the unlawful subsidies. IWV has run and will continue to run numerous calls to action and social media campaigns, coalition letters, and press conferences to demand that lawmakers buy insurance as other Americans do, the way the law requires. Our speakers today are Heather Higgins, Senator Ron Johnson, Representative Ron DeSantis, and Phil Kerpen. All of our speakers have been outspoken advocates for rescinding the OPM rule and ensuring equal treatment under law. Heather Higgins is President and CEO of Independent Women's Voice. She has led the group in our No Washington Exemption project and the related efforts I just described. Heather is the founder and chair of the Repeal and Reform Coalition, a coalition that meets on Capitol Hill and works to improve health policy. Heather penned an op-ed for the Wall Street Journal in the Monday, July 24th edition on the OPM rule, explaining that the Washington exemption is not a partisan issue, but rather both a fairness issue and a strategic one for President Trump. Heather explained that if President Trump wants to see broader health reform, he must align the interests of lawmakers with his voters by taking away the Washington exemption. Senator Ron Johnson of Wisconsin has been an outspoken critic of the Washington exemption from early on. In 2013, he co-sponsored legislation to undo the exemption, and in 2014, he filed a federal lawsuit against the OPM rule. More recently, Senator Johnson offered an amendment to the Senate health reform legislation that would have undone the special treatment available to Congress. Representative Ron DeSantis of Florida's 6th District has similarly been engaged in this issue from the beginning. Recently, Representative DeSantis sponsored H.R. 499, the No Exemption for Washington from Obamacare Act, but this is not the first time he has sponsored such legislation. He was among the first to do so in 2013. Both the Congressman and Senator Johnson have appropriately opted to decline the subsidies that they're seeking to eliminate. And finally, Phil Kerpen is president of American Commitment, a public policy organization dedicated to restoring the American commitment to free markets, economic growth, constitutionally limited government, property rights, and individual freedom. Phil has been an advocate for undoing the Washington exemption, has written extensively on the subject, and recently led a coalition of 40 groups to send a letter to President Trump asking him to direct the OPM to rescind the current rule and issue a new one that conforms with statutory law. And now I'll turn the call over to our speakers, beginning with Heather Higgins.
Thank you, Hadley, and thank you all for joining us. Thank you particularly to Senators Johnson and Representative DeSantis, who have been stalwarts in this important, principled, and politically highly unpopular, difficult fight within the halls of Congress. Hugely popular outside of it, but socially certainly challenging within the ranks of Congress. I first became aware in 2012 that Democratic staff were apoplectic, that they were going to be put onto the exchanges, they were going to be getting fewer choices, lower quality care, as well as losing their heavily subsidized plans. And eventually Republican staff, and I suspect as a sexist aside here that this is a function of the fact that there are more women in Democratic staff leadership positions than on the right, eventually the GOP staff also figured this out. And so we had 3 years of back and forth culminating in the summer of 2013, trying very hard to figure out some way to get themselves out from under the legislation that they had passed, and in fact had explicitly voted down Grassley's amendment, which would have provided them subsidies while putting them on these exchanges. We fought the good fight in 2013. Senator Vitter came along. There was even an attempt to put this onto, if you all recall, there was a fight over the CR in October of that year, but he voted against, and so the Washington exemption did not get undone. And just want to clarify, by exemption, we're not saying that all members of Congress are exempt. There are members who are on it, but they are exempt in the sense that they have the option of describing much of their staffs as not official, so they are not touched by it. And so they are exempt from it, and those who are on the exchanges are offered these very generous subsidies, which would be illegal for anybody else outside of Congress. The aspect of this that I want to talk about is strategic. If one is in fact serious about getting health care reform, what the voters who have been hurt by the Affordable Care Act care about when it comes to repeal and reform is lower costs, getting a plan with the choices they actually want, and being able to see the doctor they actually want to see. And if those things don't happen, repeal will have been just a Washington game as far as they're concerned, and they won't think that this administration has fulfilled its promise. We've seen now the House and various Senate versions of the bill. There was some lowering of costs and getting the plans that people wanted, but they were not nearly to the point that what people thought would happen by a repeal process. The only way to get both a bill that addresses the voters' concern and will get the votes needed for passage is if Congress is in the same boat as those voters, using the exchanges without exemption or subsidy, because doing that means that Congress itself won't get relief until and unless, and to the same extent as voters do. This is a way to harness human psychology and the unfortunate reality that there is nothing so motivating as one's own self-interest. To that end, the President recently tweeted, and tweeted again this morning, that this double standard bailout might end if we don't get repeal. What we on this call, I think, all believe is that might is a good first step, but it's not enough. What might get undone leaves you potentially with the worst of all possible words. You get some sort of a lousy partial repeal replace that leaves voters very unsatisfied, and yet an obligation to continue this double standard for Congress. So what we would advocate at Independent Women's Voice, if the President's goal is to achieve a sizable impact on the quality of repeal and reform, to make voters happy, and to make sure that he gets the vote needed for passage, is that he should be very clear that he is instructing the Office of Personnel Management that Congress is not a small business, whether or not they vote for repeal, and that Congress will be treated under the Affordable Care Act as the law intended, like everyone else who is on the exchanges, and to the extent that the American people get relief, Congress will get relief and potentially even go back to their old plans, and to the extent that the Affordable Care Act's regulations continue and they don't, Congress won't either. The advantages of these things would be threefold. First, he'd be taking on the Moscow on the Potomac culture. Secondly, he'll be telling Congress that they will be eating their own cooking, which will radically improve what's on that menu. And finally, since Congress, Democrats and Republicans alike, desperately do not want to be on the exchanges, you pretty much guarantee that you will get, in fact, the votes that you need, and perhaps even some bipartisan votes to help Congress solve this problem. I want to now turn it over to, I believe, Phil Kerpen, who's going to give you some more background information on the mechanics by which this totally bizarre and illegal carve-out was created. Phil?
Sure. Thank you, Heather. I'll give the history as quickly as I can because it gets very complicated very quickly, but I think there are some key points that we should not lose sight of and that make the seemingly complicated really quite simple in terms of how illegitimate and outrageous what they ultimately did was. When this bill was moving forward, the bill that became the Patient Protection and Affordable Care Act was moving forward in the Senate Finance Committee, there was an amendment by Chuck Grassley that required Congress to go in the exchanges and included an employer contribution to pay for their coverage. That was not included in the bill that Harry Reid took to the Senate floor that was ultimately passed. Instead was a new provision, 1312D3D, that does not authorize an employer contribution. It requires that they go into an exchange and does not authorize any employer contribution. Interestingly, Charles Grassley introduced another amendment when the reconciliation sidecar bill came back in March of 2010 that would have restored the employer contribution and also would have required the administration to go into the exchange, and that was defeated on a party line vote. And so we have pretty clear legislative history that the employer contribution had been considered and rejected twice when the bill was replaced on the floor with the Reid substitute, and then again when an amendment to restore it was rejected. So the statute did not include an employer contribution, but as Heather pointed out, there was a hue and cry on Capitol Hill in 2013 as this was about to take effect for 2014, and the staffers were saying, how can we make ends meet if we have to go into Obamacare and pay these premiums? They could be very high. We don't want to be exposed to that. And they basically turned to President Obama to save them from Obamacare, and that's what the OPM rule did. The OPM rule asserted that there was authority under OPM statute that it administers to recognize a non-FEHB plan for appropriating FEHB funds. That's clearly contrary to what Chapter 89 of Title V says. Moreover, the only way that they could even attempt to do so was to pull the sleight of hand in which they said that Congress is a small business, and that's because even had an employer contribution been possible under a different statute, under Title V, which it wasn't, it still would not be possible to make an employer contribution on the individual exchange that members of Congress and their staff were supposed to be in, because there is no mechanism in the individual exchange for an employer contribution, and in fact, there was contrary rulemaking from HHS that prohibited employer contributions towards individual health plans. So no employer in the country other than Congress can make an employer contribution towards an individual health plan. And the way they got around that is where this whole thing became so ridiculous and so sublimely absurd that literally no one can defend it when confronted with the documents that they used to implement this scheme. Both the House and the Senate filed blatantly false documents claiming each to be a small employer with less than 50 employees each, and then they went ahead and signed up under the Small Business Exchange, and they signed up 12,000 people as employees of the two small businesses that had supposedly less than 50 employees each. And by the way, the only reason we even know about that is that Judicial Watch obtained those documents in FOIA litigation. The press release and the public explanations at the time outright lied. They indicated that each office would sign up as a small business employer, each congressional office, and that never occurred, and it never could occur as a practical matter because the offices do not have individual employer identification numbers. They don't run their own payroll. There's one EIN for the House, and the clerk runs the payroll, and there's one EIN for the Senate. The Senate dispersing office runs the payroll, and so secretly, they went ahead and filed false documents, fraudulent documents. And whatever you think about the legislative history or what's right as a matter of policy or what have you, it seems to me very simple that if this were a legitimate scheme, it would not require blatantly false documents. And I hope that if the administration goes ahead with what Heather's suggesting and what we've suggested and rescinds this rule, I hope that whoever announces it has the false documents poster size behind them and defies anyone to defend a scheme that relies on false documents. And I'll leave it at that. Thank you, Heather, for having me on the call.
And now we'll hear from Senator Ron Johnson.
Well, thank you, Phil and Heather and Hadley. I think the earlier speakers have pretty well laid out the case. Let me just tell you why this is absolutely necessary. I'll give you the stories of being on the inside as part of the core group. As an accountant, as a manufacturer, I solve a lot of problems. There's a process you go through, and it starts with information. The problem is in Washington, D.C., they really don't know how to go through the problem-solving process. So information, if you obtain it at all, comes at the very, very end. We don't establish goals. One of the primary goals that I was trying to establish in the core groups was to bring down the gross cost of premiums. The problem and the reason nobody would even consider concentrating on that core goal, bringing down gross premiums, is because what has caused premiums to be artificially increased is so politically popular. In Tennessee, for example, their premiums for a 40-year-old male have increased 314% since the implementation of the Affordable Care Act. 73 to 76% of that increase is due to guaranteed issue covering people with pre-existing conditions and community rating. And so we completely took that off the table. That caused me to write a column for the New York Times talking about the forgotten men and women that Bill Clinton were talking about, the people that are out there busting it, working 60 hours a week, having watched their premiums double, in the case of Tennessee, triple, their coverage cut in half, and nobody in this internal debate, virtually nothing in the House bill nor the Senate bill was addressing those individuals who are working hard, don't qualify for subsidies, can't afford insurance. 8 million Americans are basically paying the penalty rather than trying to purchase unaffordable care. 46% of those make less than $25,000. 84% make less than 50%. So on Thursday, last Thursday, at the Senate lunch prior to us taking up the skinny repeal and possibly going to Vote-A-Rama, I announced to the Republican conference that I would not agree to consent. I would not consent to ending the Vote-A-Rama until my amendment, which would have put members of Congress in the same position as those forgotten men and women, were to get a vote. In other words, what I told my colleagues, I told them a story about Vernon and Sherry Colby, people I just talked to 2 days before that had basically had to pony up $15,000 additional dollars for Obamacare because they made $59,000 and they had to repay their subsidies. They had to deplete their 401k. They had to sell their house before they would lose it in foreclosure. And I hate to say that I don't think anybody even really batted an eye at that story. And that's just the problem. Until members of Congress are put in that exact same position as Sherry and Vern Colby, the forgotten men and women, we are not going to address the root cause of this problem. We're not going to bring down premiums. And so I basically announced that I'm going to put that amendment forward. We're going to vote on it so that members of Congress are in that exact same position, although I did caveat that going, we're not exactly in the same position because we make $174,000. The Colbys are only making $59,000. So it's just a very sad reality until members of Congress are in that same position. We're not going to fix this problem. And that's why I really give Heather and Hadley and everybody involved in this process, in this project, a lot of kudos. We've got to do this. We've got to fix this problem. And this is, unfortunately, probably the only way we're going to be actually able to do it. And I guess I think now I'll turn it over to Congressman DeSantis.
Well, great. Well, thank you, Senator. I just have a quick, I agree with everything that's been said. One thing is people try to say, oh, these guys want to hurt the staff. We can raise our staff's pay. And so if this rule were repealed, I'd have to go to my staff and say, okay, maybe you all get a certain increase to make up for that. So the staff can be remedied. The opposition is really because the members can't change their pay. And a lot of members don't want to have to pay more. They don't want to be in that same boat as Senator Johnson's constituents. This thing actually did get a vote in the House September 30th, 2013. It was attached to a CR, and this is in the defund Obamacare. That had lost. The delay of Obamacare had lost. So the last-ditch effort out of the House was a CR with this provision struck, and then the delay of the individual mandate. That passed the House. Reid killed it in the Senate. It was interesting that there were some Republicans who voted against it because of this particular provision. It's not lawful. I think Phil went through that, and I've seen analyses say, oh, this is nonsense. It's totally fine, just an employer contribution. Any analysis I've ever read that tries to justify it never cites the applicable statute. They just make conclusory statements. I've seen fact checks that have just been disastrous where you're not even citing the law. So if you're not citing the law, you're not doing it right. And if this were legal, Heather kind of talked about it, but people were whispering about this 2012 at the tail end when I came up as a member-elect, and then through 2013, what are we going to do about this? What are we going to do about this? Because they knew it was going to change for the worse for members and staff. And if the law had provided them to have these subsidies the whole time, you wouldn't have had people freaking out behind the scenes, and you wouldn't have, as Phil suggested, needed to have Congress pose as a small business with fewer than 50 employees in order to get this big subsidy. That just would not have been necessary. So when the president calls it a bailout, I mean, it really was a bailout because they're getting around what the statute ultimately provides for. So I'm hoping that the president will stay engaged on this, that this is an issue we can continue to push on the outside, but then obviously in the inside of Congress. Thing is, it's very unpopular inside of Congress, but once it's teed up and you got to go on record, it's a little bit different ballgame at that point. So I'm hoping that this could maybe help us get back to the table and actually do what we promised the voters we would do. But I think it makes Congress look horrible. You fail in a vote in the Senate, you just walk away and keep this subsidy that you have that's not even lawful. I don't think that that's credible with the voters. Thanks, guys.
Thank you, Congressman, and thank you to all of our speakers. We will now open the call up for questions. But first, I want to let everyone on the call know if you have any questions after today's call, you can follow up and direct those questions to our Vice President of Communications at Independent Women's Voice. Her name is Victoria Coley, and her email address is victoria.coley@iwv.org. That's victoria.coley@iwv.org. Now, our operator is going to join us and explain how to ask a question. Thank you.
Thank you. If you would like to ask a question, please press *1 on your phone. Please make sure your mute function is turned off to allow your signal to reach our equipment. Again, that's *1 if you'd like to ask a question. And we'll go first to Julie Rovner with Kaiser Health News.
Hi, thanks for doing this. I'm just curious, with the president sort of threatening to make this go away, can he not order OPM to just change the regulation? Would that not be one? I mean, do you actually need legislation in the absence of a Democratic president?
Well, I'm happy to take that. This is Phil Kerpen.
Phil, do you want to take this? Go ahead.
Yeah, the president absolutely has the power to direct OPM to change this rule. This is a policy that was established by rulemaking by the executive branch at the Office of Personnel Management, and it can be rescinded and revised and revisited by the same mechanism. And he could either do that by a presidential memorandum directing OPM to do that, or it's something OPM could just do. So he could just informally call over there and ask that they do it. But yeah, absolutely. Everything that's done ever in Washington could potentially be subject to litigation, but I think he would be on very solid ground because the interpretation we're suggesting is a much more straightforward interpretation of the statute than the current rule.
Thank you.
And we'll go next to Sarah Hansard with Bloomberg BNA.
Hi, thank you. Yeah, I just wanted to check what you're calling for then is for President Trump to direct OPM to undo the regulation that they did in 2012 or 2013, I can't remember now, or you're calling for OPM to undo it. Is that mainly what you're calling for?
It was done in August of 2013. And yes, whether OPM just does it or the president makes it very clear that he's calling on OPM to do this. OPM, as I recall, had been approached several times before they came up with a solution of claiming that Congress was a small business and then revising the OPM mandate to make payments outside of the federal employee health benefit system, which OPM is not authorized to do. And that was their fix. But there should be a directive to OPM, or OPM could just do it, and then OPM would need to set forth a reason, which should not be hard, as the current legal position is untenable for anybody who's actually read the law. There would be a period of comment, and then at the conclusion of the comment period, they'd publish a new final rule that would basically follow the statutory scheme set out in the Affordable Care Act. I believe it's Section 1312D3D, which would say that members and their aides would obtain coverage through the exchange and would be ineligible for subsidies in the federal employees health benefit program.
Okay, so you're not calling for legislation. You're calling for regulatory action.
We think that the easiest way to do it is through regulatory action, but if the regulatory entity won't act, then I think Senator Johnson and Representative DeSantis are perfectly willing to try and move ahead with legislation.
Okay, and they wouldn't be, I mean, unless they happen to be low income, they wouldn't be eligible for subsidies. They just have to buy through the individual exchange, right?
Yeah, that's right. Just jumping in again, this is Phil Kerpen. I think what Heather's suggesting in terms of the political alignment of their situation is important to understand, and Senator Johnson talked about this also. Congress and most of their staff, other than maybe some very low-paid, low-level staff, Congress and most of their staff would be in the same position of the people who've been hardest hit by the current law, which is people who make too much money to qualify for subsidies but do not have employer-provided coverage.
Okay.
And they would feel the pain of paying for those very high premiums without being able to qualify for income-based subsidies.
Okay.
This is Senator Johnson, quick piping in here. One of the reasons in my amendment, I did exclude staff. Part of the problem by doing with regulatory changes, then you have to follow the law, and that would include staff. I really only wanted to make members of Congress, I only wanted to put them in the same position. Staff, again, I ran an organization. I want the people who work for me to have health care, and I'm happy to give them an employer contribution. It's members of Congress that are responsible for changing this law, for bringing down premiums. So a legislative solution can isolate members of Congress. A regulatory solution, you're going to have to follow the law, and that includes staff as well.
Okay, but aren't members of Congress doing this? Yeah, aren't they in the exchange, the members themselves?
Yes, we're in the exchange, but we qualify or we're being given employer contributions. I have to write a check every quarter to pay it back. But that's what was expressly forbidden with the Grassley Amendment when it was voted down for employer contribution to be included. That's not allowed by the law.
I believe also that under the law, leadership got a carve-out, as did committee chairs. In a perfect world, leadership and committee chairs would be the first ones to be subject to the law the same as everyone else and not get that carve-out.
Okay, thanks.
And we'll move next to Jennifer Haberkorn with Politico.
Hi, thanks for taking my question. Wanted to confirm both Senator Johnson and Congressman DeSantis that you guys have coverage with an Obamacare plan without the government payment. And since my other questions have been asked, I'm wondering what you guys think today about, if this Obamacare conversation in general can actually move forward. Obviously, there's talk now of bipartisan Graham Cassidy things. Just curious what your thoughts are.
Well, this is Senator Johnson. For the first 3 years, I was buying policies in Wisconsin just on the individual market, got no employer contribution whatsoever. Every year, the insurer would pull out of the state and I have to get new coverage. So when I got reelected, I did take the DC exchange and I paid back the employer contribution. It's the only way I can really do that. From a standpoint of what we need to do moving forward, the Obamacare exchanges are collapsing and we have to do something. So we're certainly not quitting. Conversations continue with both House, Senate members, and White House, and governors for that matter. And so we're moving forward. Now, we maybe do that set aside while we work on tax reform, which is what I'd propose. But no, we've got to continue to work on this health care system because of Obamacare is a mess.
If I could jump in, I think one of the challenges that you've got here is you've got the artifice of reconciliation, because there are, people forget this, there's not just one filibuster in the Senate, there are two. And the first one is what causes legislation to pass the House and then never get to the floor of the Senate, because the motion to proceed to consider is used as a 60-vote threshold to prevent deliberation of what is supposed to be the world's most deliberative body. And the reason for that is contrary, the way it's being used is contrary to the intent, which was the purpose of a filibuster was always to enable debate to continue, not to shut it down. And so part of the problem that's been had by Republicans on this bill is that people who wanted to make sure that the bill was comprehensive and actually went to the things that didn't necessarily rate a good score in terms of, creating a new baseline for tax policy, but actually freedom and choice and cost issues of the average American citizen who's subject to this law, that doesn't really fly under reconciliation. And so one of the big challenges here is how to undo something through this artificial process, or is there some way to force a vote through regular order? And we believe that were the congressional exemption undone, you could actually do this through regular order, because then members and senators would have a vested interest in making sure that the best repeal and reform proposal was passed.
Ms. Abercorn, was there anything further?
Oh, I'm sorry. No, thank you. Oh,
okay.
Congressman DeSantis didn't reply. Is he still online?
Yes, please check your mute button, sir.
So this is Senator Johnson again. Let me just tell you about what that contribution is, by the way. I write a check every quarter for a little over $3,000. So the subsidy, the bailout, is about $12,000 per year per member.
Thanks, Senator.
And as a reminder, it is *1 if you'd like to ask a question. We'll go next to Miguel Sancho with ABC News.
Hello, thank you for taking my call. Insofar as the goal here appears to be able to make some degree of parity between members of Congress and the constituents who deal with the realities and vicissitudes of the ACA, OPM certainly seems like a big part of that. There's another perk that comes up from time to time, which is the kind of fringe benefit of the Office of the Attending Physician, where members of Congress pay about $50 a month for access to health care services there in the Capitol building. And I'm wondering if Senator Johnson and DeSantis and Representative DeSantis have a position on that other perk, if that's something they'd want to get rid of, or if there's justification for that we should know about.
I think again, this is off the top of my head, I think every member of Congress who want to avail themselves pay something like $500 some a year just to, do that. I go in for one physical and I get my, if I don't get my vaccinations from Walgreens in Wisconsin, I'll quick do it here when I've got time. So, you take out, I think that attending physician office is pretty well funded from just member contributions.
Mr. Sancho, was there anything further, sir?
Well, what about another perk about members of Congress being able to have both Medicare and buy additional insurance on the DC HealthLink exchange? Is that problematic in their eyes, or should that stay?
I'm 62, so I don't qualify for Medicare, so I'm not even aware of that.
Okay, thank you.
And we have nothing further in the queue, but just a final reminder, it is *1 if you would like to ask a question. And it appears we have no further questions at this time.
Okay, thank you. I wanted to remind everyone, if you have follow-up questions after today's call, you can reach Victoria Coley at Independent Women's Voice. It's victoria.coley@iwv.org. And again, from Independent Women's Voice, we want to especially thank our speakers today, and thanks to everyone who joined us.
Thank you, and that does conclude today's conference. Thank you for your participation. You may now disconnect.